My daughter has cerebral palsy. It affects her right side. She wears a brace to try to help her, and she has difficulty. We have difficulty getting her foot down in the brace. She often complains that it hurts her. She also trips and falls many times a day.
Botulinum toxin injections are a well-established treatment for spasticity in CP. It is important to identify the goals for treatment and communicate them clearly to the patient's family. Goal attainment scaling, which has been used for over 40 years, allows to quantify the achievement of clinical goals. It provides a framework for patients' families to identify goals that are meaningful to them. Using this scale not only gives the clinician an objective, quantifiable tool, but also enhances communication and provides a framework for the patients and their families to be involved in the decision-making process. Therefore, the goal attainment scale provides a framework for identifying goals, allows objective measurement of treatment, and it does not replace standardized outcome measures. Our purpose today is threefold. First, to show you how to create goals with your patients. Secondly, to teach you how to weigh these goals. And finally, to demonstrate how to rate the success of achievement of these goals. The GAS is also comprised of a mathematical formula which lends itself to statistical analysis, but this will not be included in our discussion here today. So let's begin. The goals are set in collaboration with the patient and must be SMART. That means specific, measurable, achievable, realistic, and timed. An example of a specific goal would be the patient will fall less, or the patient will tolerate the brace. Goals such as improve gait are too vague, and they should not be used. Choose a means of quantifying the outcome. For example, if the child is falling 10 times a day, your goal may be to have him fall less than 5 times a day. Or if a child cannot tolerate his brace, your goal may be for him to tolerate the brace for at least 6 hours a day. Always choose goals that are achievable within a given time frame. Perhaps the parents have a long-term goal, that their child will be able to walk without a brace. This may be possible in the long term, but it is important that you counsel them to set incremental goals that are achievable. Ultimately, the goal should reflect a realistic outcome. And finally, the goal should be achievable within the treatment time frame. Always choose discrete time frames in which to measure outcomes. Okay, Ms. Young. You just told me that your daughter has been having problems walking with her right foot, that she trips and falls a lot. What are your expectations for this treatment with botulinum toxin that are about to give her?
I would like her to be able to walk completely normal. I want to see her be able to get around on the playground like all of her other friends without looking any different.
Well, let's clarify that a little bit. And I know that's very good because we would love to see her walk normal, but that may be a little bit difficult because she also has some weakness and other issues. So let me ask you, what do you mean by participating more with her peers? What would you like to see happen so she can do those things?
I want to see her be able to walk without tripping. I'd love to see her go through a day without falling and skinning her knees or her elbows, and be able to climb and just play like all the other kids.
Very well. So tell me more about how many times she trips and falls every day. Can you give me an estimate?
She trips all day long. I wouldn't even be able to count. I don't know how many times.
Do you think she trips 20 times a day?
Maybe 10.
10 times a day. Mm-hmm. And how many times do you think she falls every day?
Probably at least 3 times a day.
Now, I know that she wears a brace, and how long can she tolerate that brace?
Right now, not very long at all. We have difficulty getting it on in the morning, and then her teacher tells me that she has to take it off after about 3 hours, and we see the same on the weekend.
So she tolerates the brace at least 3 hours a day?
About 3, yes.
Emily, as a physical therapist, Do you think we can achieve these goals of reducing tripping, falling, and improving brace use?
Yes, I think we can reduce tripping and falling in this patient. I think she has an active dorsiflex, so I think if we reduce her tone, she'll be able to improve brace use, which will help her to clear her foot so she won't trip and fall as much. I don't think she will have a normal gait. She'll always have a different gait than her peers.
Ms. Young, our medical team has got together and discussed your goals that you have for your child. And we agree that with botulinum toxin, we may be able to reduce the falls, the tripping, and even increase the time that she's able to tolerate her brace. So let's aim to reduce the number of tripping to less than 10 times a day and to reduce the falls to less than 3 times a day. And if that's okay with you, maybe increase the time that she's able to tolerate her brace more than 6 hours a day. You need to create 1, 2, 3 SMART goals within a specific time frame. Be sure to document that you have discussed with the family these goals and that they agree with the expected outcome. Now let's move on to stage 2, weighing the goals. Both the parents and the medical team will weigh the goals. Some goals matter more to the parent than others, and some goals present more of a challenge than others. In order to take these factors into account, goals will be weighed for both their importance to the family as well as for their perceived difficulty as rated by the physician and the medical team. So, Ms. Young, let's talk about how important these goals are to you. Let's first talk about tripping, reduced tripping. How important is that to you? Very important, moderately important, a little important, or not important at all?
I would say very important.
So then we'll score that as a 3. For the second goal, which is falling, how important is that to you?
Again, very important.
So we'll score that as a 3. How about brace use?
Very important. That helps her fall less.
So we'll score it as a 3. Emily, you are a physical therapist. I need your input. I need to know how difficult you think is going to be for us to achieve these goals within the next 4 weeks.
Tripping and falling, that would be a moderately difficult goal. I think as long as she's wearing her brace, that will be able to be achieved. I do think that we will be able to improve her brace use up to 6 hours a day. So I would rate that at a difficulty level of not at all.
Now that we have created and weighed our goals, we can treat our patient. A 5-point scale is used to standardize how we rate goal attainment. Let's begin by reviewing the goals for this patient. Tripping. The goal was to reduce tripping less than 10 times a day. An expected outcome of 0 will be 5 to 9 times a day. If the child trips 1 to 4 times a day, will be a +1. If she doesn't trip at all, will be a +2. Falling. The goal is to reduce falling less than 3 times a day. An expected outcome of 0 will be 2 times a day. If the child falls once a day, will be a +1, and if she doesn't fall at all, will be +2. Tolerating the brace. The expected outcome of 0 will be 4 to 6 hours a day. If the child can tolerate the brace 7 to 8 hours a day, will be a +1, and if she tolerates the brace more than 8 hours a day, is a +2. Remember, the different levels of goal achievement need to be determined before treatment starts. Hello, Ms. Young. It's nice to see you again. It's been 4 weeks since we gave your daughter the botulinum toxin injections in her leg. Tell us, what has happened?
Well, I think the most dramatic thing is she is able to tolerate her brace all day long now, so 8 hours, which is huge for us. And when she wears her brace, she is tripping and falling less. We still have some tripping when she's not in her brace. She catches her toes.
So how many times a day do you think she trips every day when she doesn't use the brace?
Without her brace, she probably would trip 8 to 10 times per day.
And falling?
Probably still about 3 times a day.
So for tripping, we'll have a -1 because we're pretty much at baseline. And for the falling is a -1 as well, because she's still falling about the same number of times a day. But for the brace use, she has exceeded our expectations. She's tolerating the brace more than 8 hours a day. Therefore, we're going to give her a +2. In summary, the goal attainment scaling is not designed to replace standardized outcome measures. However, it is well suited to assess the achievement of goals that are meaningful to the patient and his family. In addition, the creation of goals gives the patient's family an active voice in their child's care. We therefore recommend that the GAS be used in conjunction with standardized outcome measures.